fortunately with my jobs, both of my jobs,
Yeah.
you know, it's always been about sort of the larger region and the larger sort of issues. And the other advantage, I think, to working in healthcare, I mean, I've worked in healthcare for 30 years, is, as you know, health it's not just about hospitals, right?
No, yeah.
It is so huge. It's, you know, whether you have doctors in your community, it's an economic development issue. You know, to whether you have walking paths for people to be able to be physically active so that they can be healthier and prevent diabetes. You know, so I've always sort of seen issues, I think, from sort of the larger perspective. I've had to, you know, and had to quickly understand what are the issues at play. And, you know, there's other sort of tools that are very informative too, like things like the community health assessments that regional health authorities do. There's a lot of information in those about, you know, what the issues are and what the resources and the services and things are in all the different communities. So I suppose in those ways.
Great, thank you for that. You've had the opportunity to witness firsthand the traveling potential of our people going over to the Philippines and doing a recruitment process over there, and some coming back. And Dauphin has been a benefactor. I don't know if Roblin got part of that. Yep. Okay, so you're aware of the spin-off and how that works. What is your overall view of that program in terms of how we aren't or seeming to get the numbers out into rural Manitoba? How does that program sit with you?
Well, it seems to have worked well. Like you say, I'm only familiar with the nurses that were recruited to Dauphin, Swan River, and Roblin. I know there was others in the Assiniboine Regional Health Authority, right? So those ones have been fairly successful. Like, again, I don't know about here whether they've stayed, but ours have. You know, there was some moving around. Some left Swan River to go to Dauphin, so there was some moving around. But they seem to be happy. I mean, it seems to have worked. They seem to have been, you know, taken in by the communities. The communities were quite excited to have them as well.
Great.
So from what I've seen, it's been a positive.
We lost one to Brandon because she wanted a bigger market, but we gained two. So things, you know, that's a fair trade.
Great, yeah.
Let's talk about the doctor scenario. We've been heavily involved here in terms of recruitment, and I'm just wondering, and I understand that there's certain doctors that can come in and they can almost immediately start right away because their credentials and where they come from qualifies them. But I'm wondering, has you or your party given any thought to the mentoring process where somebody may come in from a different country that's not quite as recognizable, say, South African doctor? Right. What about instituting a mentor program? Can we get your views on that?
Yes. And again, those are the NDP party platforms Jack Layton has been announcing and talking about, and some of those specific issues that we need to make it easier. That, like you say, I mean, some seem to be able to come in fairly quickly. Other ones, it can take a very long time. So we have to figure out a way to get those doctors working quicker. We've also talked about repatriating some Canadian-born physicians who have gone maybe and studied elsewhere, so they've gotten their training somewhere else, but they understand the Canadian healthcare system.
Sure.
Right? So in some ways, you know, can we somehow bring those people back? That would be really advantageous, because there's a lot for foreign-trained doctors to sort of learn, not just about sort of medicine, but the whole Canadian healthcare system, and then their own community and how everything sort of works. So, you know, there's other ways to sort of look at how we can get trained doctors back into Canada, and definitely more quickly. And the examination process, and you're right, I mean, if there was mentoring, direct mentorship, you know, some of those doctors could probably write those exams quicker, right? You know, because that's part of the process, and then maybe they don't pass the exam the first time, and so, you know, they have to wait longer.
Yeah.
Yeah.
I seem to get hung up when I hear different parties portray themselves as we will get rid of some of the bureaucracy. And all of a sudden you go in, like sometimes they suggest, we'll go on in online. We go in online, and now there's 9 pages of bureaucracy to get through in order to get to the end result.
Right.
And we know, like with the Statistics Canada form, they say they've shortened it to make it easier for everybody. Have you been approached about things like that? in order to try and shorten the opportunities for everybody and anybody? Have you been approached to look at that?
Now, are you referring to doctors?
No, anything, any of the forms that are out there
I
in the bureaucratic office.
Right,
We have a hard time trying to get through all this. Similarly, as people say when they pick up the phone and you hear French or English, no comment on that. Now, hit 1, 4, hit 2, 4, hit 3, 4, and it goes down to 10.
Right.
Then when you get into the right one you want, then you go from 1 through 6. To a lot of people, that's very discouraging.
Yes.
Have you been approached and spoken to about things like that?
No,
whatever happened to the good old voice at the end of the line?
I'd love to see that, and we don't particularly have any policies right now about that. But you're absolutely right, and I don't mean to make sweeping generalizations, but I know for the older population, it's even more difficult. I mean, my poor mom would, used to say, "Well, I didn't bother to leave a message. I'll just call back later." Well, no, Mom. Like you'll never get through if you don't leave a message. But like not even understanding really how that whole complex technology system works, and then forget like the online forms. I'm challenged by online forums.
I hear you. I hear you.
Yeah.
And you brought up another subject to which I wanted to get involved with you on, is that baby boomer era for me is gone by. Now we're looking at another baby boomer era that's coming up. We're also talking about health care in terms of those people. We're wanting them to be staying at home much longer. I understand that your party has touched that subject. Do you want to just elaborate on that a little more for us?
Sure. There's a few platforms that we've announced recently with regards to that. One of them is to look at making home care and long-term care an insured health service. So that just like you're going to the doctor is covered universally, so would home care and long-term care, including those things. And really looking at a national, from a national perspective, the home care program. There's some places, and I think our area, we're pretty lucky when it comes to home care, but there's a lot of places across the country that don't come close to us in terms of the home care services. So to really emphasize that we need to strengthen and support home care services. And I mean, even though we have great home care services, there's still lots of struggles in terms of staffing. Like, getting enough people to work for home care. So, those services become pretty precarious when all of a sudden you don't have, home care workers or a couple are sick. It can throw the whole system into havoc. So you have to have the family sort of backing up the system. And, so it's a bit precarious. So even though we say we want to support people in their homes and keep them in their homes, we have to have the right supports there to be able to do it. Otherwise, it's not a good situation. So that's one, to sort of really focus on the home care situation. One of the other platforms that I thought was really kind of interesting, because it's kind of also tied into housing, because we know housing is another issue. I mean, we have long-term care, so when you're really sick and you need 24-hour nursing, we have somewhere for you. Or, we have home care if you just kind of need some help. But what about all those people in the middle? There's a lot, before I need to be in a personal care home, but I can't really stay at home anymore. So there's a huge gap in there that we really need to address, and that's a housing issue, right? It needs to be the right kind of place that you can live in comfortably, but it has the kind of supports. One of the things our party has suggested, or one of the platforms, is creating a program whereby we would give a grant, a 50% matching grant up to a total of $35,000 to anyone who would like to convert an area in their home into like a suite, into a livable sort of suite for one of their elderly family members. And I thought, now that's a good idea. That makes a lot of sense, because just finding somewhere to live, is also a challenge. And that way you're close to family, and so it's ideas like that, I think, that we really need to sort of look at.
I appreciate your answer. I'd like to come back to it by saying, or asking, with the fact that both in the household, albeit mom and dad, are working, your thought about home care plays a very predominant role here.
Yes.
Because they're going to have to come and keep their eye on.
Yes.
And that's very important too.
Yes.
So you have touched on it, so I'm glad to hear that.